Good day, doctors. Welcome to my home exercise suite for Telemedicine 101 Core Stability. Here are some simple things you can do with your patients, telemedicine, for low back pain syndromes and core stability. First of all, make sure that if you're doing telemedicine and you're doing active care, that the patient is dressed appropriately, number one, for active care, and number two, they are covered appropriately and discreetly. You don't want them in scantily clad athletic wear by any means. So make sure they're clothed appropriately so you can observe their movement patterns and that they're properly covered. So number one. So let's make it simple, especially for the docs that may not be doing a lot of rehab. Your low back pain syndrome patients, let's give them McGill's top 3 exercises and the progressions related to those 3 exercises. The curl up, the bird dog, and the side plank. And in no particular order where you can prescribe all of those. But in general, the curl up is the least innocuous, but the plank, the side plank is generally very well tolerated, as well as the bird dog or quadruped. Now, if the patient doesn't have a yoga mat at home, how about a carpeted floor? If they don't have a carpeted floor, a thick beach towel, just something for cushioning. Maybe they need 2 beach towels. All right, so that's the first thing you talk about on your telemedicine conference. So the curl up, it starts with one leg bent. McGill is all about maintaining neutral spine, so we don't want the spine to flex. We don't want it to roll. We want to maintain that neutral spine. So one hand in here, one knee bent, and you just raise your head and shoulders. Okay, level 1 curl up. Just raise the head and shoulders just like that. When the patient gets good at that, they take their hand away, and you have to be able to watch this. So make sure you can see this area, because you don't want this, doctors, okay? They have to be able to maintain that. So again, they need clothes where you can see what's happening in the lumbar spine, yet on the other hand, you don't want them scantily covered. You want them fully covered, but you have to be able to see what's happening at the lumbar spine, all right? And then you could have the hands here as you progress. But it's just this tiny curl up maintaining a neutral spine. And then ultimately you could also have them do an abdominal pre-brace and then curl up. That makes it even a little bit more difficult with the arms off the floor. Okay? Make sure the head stays in neutral. They're not jutting from the neck. It's all the movements right here. All the movements right here. Just like that. All right? If they can't feel what's going on, keep that hand in the small of the back. Okay? And if you bend both knees, it's the same thing. You don't want the pressure down like that. It's not a posterior pelvic tilt. There's only a couple of patients that need a posterior pelvic tilt. Those are your lumbar stenosis patients. Those are your spondylolisthesis patients. And maybe in acute low back pain will tolerate a posterior pelvic tilt. And actually, it's a position of relief. But in general, let's work on neutral spine. The next exercise, again, just because I want to face everybody, is the side plank. The side plank, first start in 3-point position. Hand comes over here. Do your best to maintain the neck into neutral spine so they're not here, they're not here, and then come up. Hold, 1, 2, and go back down. The crunches, you want to hold for a 2 to 3 count. Start with a set of 5 to a set of 10. 3 sets of 15 is the goal. Side plank, holding 1, 2, and go back down. Same thing. Let's build up to doing 10 of those, then 15, and then 3 sets of 15. Then you can start to hold them a little bit longer, maybe a 5 to 8 second hold or a 10-second hold, but you don't have to do as many reps. From there, you can actually do it like a bridge to come in here to make it a little bit more challenging. Then you can go to a split stance. Now I don't have sneakers on. so it's a little slippery, okay? But then a split stance side plank, okay? That's going to make it a little bit harder. Single stacked feet side plank, going to make it a little bit harder, okay? Then when you really get good, you can raise the feet up on a chair or something to elevate that way, all right? So that would be your side plank progressions. Your quadruped, your bird dog, on the hands and knees, directly, so you're not out here, you're not back there, like as best you can to a rectangle. Do a cat and a cow, do a cat and a cow, do a cat and a cow. Now that's not one of McGill's exercises, but that's a nice way to find neutral spine with your patients. You do a couple of cat-cows, then have them split the difference. And that's where they're going to do their bird dog from. However, the cat-cow is a great exercise for spinal mobility. There was a great article that just came out by Sue, S-U-H, and that was one of his top flexibility exercises for chronic low back pain. So from that position, it's opposite arm and leg, opposite arm and leg. Now, that's great, but they also be able to move one arm with just the arm moving and one leg with just the leg moving. So there's none of this, there's none of that, okay? When they can do single leg and single arm and leg with nothing else moving, then they go arm and leg, open, come back, and recover. And you go out, hold for a second, it's not real quick, and then recover. Maybe a 2 count. Go out, hold, 2 count, and then recover. How many? You want to build up to 3 sets of 15 like the other exercises. That's the goal. You may not start there. And when they can do 3 sets of 15 this way, then you can have them open up. And when they can do those, you can add some circles here and then recover. But you see, I'm not getting this, I'm not getting that. My head's not going over. When that gets easy, you add elastic resistance or you add some ankle weights. But elastic resistance is great because you can quantify this resistance because we know that the TheraBand CLX screen is just under 5 pounds, 4.6 pounds of resistance when it's stretched 100%. And we know that. So you can put that in your notes. So opposite hand and foot, and then you can load it. You can add the abduction and come back, okay? And then of course I'd be hooked up to the other side. So for your low back patients, telemedicine, keep it simple. McGill's top 3, progress them through those exercises. Maybe add some cat-cow. You can add some other nice flexibility exercises if you want. Your basic knee to chest. Right? Basic star stretch. The hamstring stretches, which are great with your CLX band. You can have the patient do a PIR with the CLX. You have them wrap it around their foot. Pull it all the way up. They do a little contraction for 5 seconds. And then they relax, and then they give them a nice pull. It's a great way to use the elastic resistance to help you facilitate stretching and mobilization. Push down and then relax. How do you quantify it? Patient required resistance of, this is going to be 10 pounds to bring the knee up to whatever the thigh, straight leg raise towards 90 degrees. Guesstimate it. 68 degrees, 70 degrees, I'm nowhere near 90. So push down for about 10 seconds and then give it a little tug, and as it comes up, let the stretch band give it some extra resistance. So they can use it for strengthening and they can use it for stretching. And those are some nice stretches for the lumbar spine. And you have some nice strengthening exercises. If you want to do more, you can add front planks. If you want to do more, you can add sit to stands for for leg and pelvic stability. So there's a lot you can do, but keep it simple right now. We only have a few more weeks of this COVID situation, so telemedicine, lumbar spine. Let's stick with McGill's top 3. If you have any questions, call me, email me, and if you need any other instructional videos, just let us know and we'll put them together for you. Have a great day. I'm Dr. Donald DeFabio, and hang in there. We're all in this together.